Hi, I'm Dave Mastovich of Mass Solutions. We work with Cucamonga Valley Medical Group, who wants to give an update on the practice and the COVID-19 situation. We have the Chief Executive Officer, Dr. Rahmi Mowjood, and the Chief Medical Officer, Dr. Kyle Smart. Gentlemen, what's the latest with the COVID-19 situation and Cucamonga Valley Medical Group?
Thank you, Dave. So, as many of our patients know, here in the state of California, we have entered a new 3-week stay-at-home order. This is partly due to the fact that we've seen a high surge of COVID cases, but it's also due to the fact that our hospitals are becoming overwhelmed with patients. Currently, the local hospital that we work with is at the brim in their own capacity, and we are hearing anecdotes of treatment having to be rendered to patients in the lobby for things that typically would be seen in the actual ER itself. So one of our colleagues described how he had to do CPR on a patient on the floor of the ER lobby because there was no space for this patient as they waited to be seen. For these reasons, and for the reasons of protecting not just the community at large, but also our patients and our fellow first responders, our frontline staff members and providers and physicians, Cucamonga Valley Medical Group has decided to shift into a hybrid schedule where we are still open and we are still seeing patients, but on a more urgent and as needed emergent basis. And we want to try to move as many of our patients to a telemedicine platform. Many of our patients have seen their providers through a telemedicine platform, either through video or through audio, since the pandemic started. So that is not going to be changing. And in fact, we are going to be offering more of those opportunities for patients to be seen that way, thereby keeping them at home, helping them stay quarantined and safe, and reducing the volume of patients that are coming through our clinics, but still providing the much needed services that Cucamonga Valley Medical Group provides. In this way, we're hoping to help do our part to ease the strain on the hospital system and to also flatten the curve that's currently increasing here in the state of California.
Yeah, I think, Dave, the way I would describe it is this is what it looks like when you don't flatten the curve. And we haven't heard that term in a while. And it's not that we're slowing down the COVID-19 pandemic, but it's trying to make it so that everybody's not getting sick with that at the same time as other basic healthcare needs need to be met. So we've seen this in New York, we've seen this in Seattle. I know in your area, in the Pittsburgh area, you had a pretty significant spike in the summer, and now California's having it. And so what flattening the curve, when not flattening the curve looks like is pharmacies are running out of medications, hospitals are having more patients come in with coronavirus or COVID-19, as well as things like Dr. Mowjood described, acute appendicitis or someone who's critically ill and codes waiting in the lobby for care. And even the swabbing centers are overwhelmed. And the labs that process the swabs went from 3 days to 1 to 2 week turnaround because they're just inundated with more patients than our system can take care of. And so that's why it's important to continue to use the precautions, especially when you're in an area of the country that is having a spike in infections.
Dr. Mowjood, what's the major takeaway?
So what we really want to impart to people is to take this 3-week stay at home seriously. Everyone's been doing a great job in trying to socially distance, but we know it's tiring. We know that there's fatigue in having to stay away from doing the things that we like to do. But because of what we're seeing in the hospitals and because of what we've seen in the clinics, really work on flattening the curve again by taking the quarantine in the next 3 to 4 weeks seriously and staying home. And we're trying to do our part. We are still here and available for all of your needs, as is the local hospital. They are still open and they're still seeing patients just like we are. But if we can make this 3-week quarantine and stay at home order count, then all of our services, all the hospital services will continue to be available for everyone, whether it's a COVID related illness or anything else.
I agree. I think that that taking this virus seriously 8 months into the pandemic is important, and especially through this holiday season. It starts with Halloween, goes into Thanksgiving, Christmas, New Year's, all the way to Super Bowl. And all the Super Bowl parties, they're going to look a little bit different this year, but those sacrifices are going to pay off for people to be able to access the healthcare they need, whether it's COVID-19 related or not. And that's really the message that we wanted to reaffirm today.
Dr. Smart, Dr. Mowjood, thank you for this valuable information. More videos to come.